Thank you, everyone. My name is Thivya Shanthakumar, and today I will be talking about the environmental health impacts on Indigenous peoples. I would like to acknowledge the land that I am on is the traditional territory of many nations, including the Mississaugas of the Credit, the Chippewa, the Haudenosaunee, and the Wet'nut peoples, and is now home to many diverse First Nation, Inuit, and Métis people. I also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit and the Williams Treaty signed with multiple Mississaugas and Chippewa bands. At this time, I would like to recommit my solidarity with Indigenous peoples as they fight for their land and rights. I would like to also thank the organization that I've had the privilege of working for during my practicum, Ontario Health and Cancer Care Ontario. My supervisor, Dr. Amanda Shepherd from the Indigenous Cancer Care Unit, and really the entire team at the ICCU. Several Indigenous stakeholders in Ontario that I've had the privilege of working with on this project, the Joint Ontario Indigenous Cancer Committee, the Champlain Inuit Services Providers Relationship Table, and the Métis Nation of Ontario, and of course, Dr. Nigel Livingston from the University of Victoria. So in 2015, Cancer Care Ontario launched the Indigenous Relationship and Cultural Safety courses, which support a call to action made in the 2015 Truth and Reconciliation Commission of Canada report. The courses highlight the importance of healthcare providers to understand and apply First Nation, Inuit, and Métis cultural safety to provide effective person-centered care. So there are currently 13 courses that are offered free of charge to healthcare providers and the general public. Since 2015, there have been over 47,000 course enrollments and over 38,000 course completions. This is approximately an 80% completion rate. So my practicum placement with that ICCU unit involved developing a brand new module on environmental health to be included. The selection of this topic actually came from requests from our Indigenous partners themselves. A literature review was conducted to inform the background research and module content, which I'll be highlighting today. So what is environmental health? Environmental health is a branch of public health that monitors the physical, chemical, and biological factors that impact human health. However, in a Canadian context, we must also understand the term environmental racism, which is a form of systemic racism and is a direct result of colonial and contemporary policies. Environmental racism is the disproportionate location and greater exposure of Indigenous and racialized communities to contamination and pollution. We must also acknowledge that Indigenous peoples share a spiritual, cultural, social, and economic relationship with their traditional lands. Indigenous peoples have unique relationships with the land, water, and air, and they've also fought for hundreds of years to protect the land, air, water, species, and cultural connections to the land from discriminatory policies and actions. So like I mentioned, this literature review that I undertook really helped develop the outline for this module. So I did do a literature review, screened over 400 articles and came up with the draft outline, which then went through various stakeholder tables and consultation. And this is the final outline. So the 3 chapters are highlighted on the left: climate change, colonial interference byproducts, and health impacts. When it comes to climate change, anything from flooding and damage on First Nation communities, wildfires, this includes the intensity, the severity, the frequency, water quality and quantity. So this includes changes in water surface temperatures, rising sea levels, and the impact on the communities, winter roads, food insecurity, which I will touch upon in the next slide, reduction of biodiversity and the importance of invasive species, drinking water advisory. So actually, as of April 9th of this year, there were 52 long-term drinking water advisories in effect in 33 communities across Canada, and majority of these advisories, 43 to be exact, are in Ontario. And of course, the associated health impacts of this. And of course, the environment goes beyond climate change. So colonial interference byproducts includes farming pesticides, acid rain, which was more of a popular term in the 1980s, but still has impacts to this day. Chemical Valley in Sarnia, Ontario, mercury poisoning, which I will also touch upon, and the proximity to dams and hydroelectrical facilities. And of course, when it comes to health impacts, anywhere from acute to long-term health impacts, mental health, physical health, and of course, overall well-being. So according to Food Secure Canada, 70% of households in Northern Ontario face food insecurity, many of them in First Nation, Inuit, and Métis communities. Environmental conditions have very strong relationships to food security. For example, store foods are primarily imported to the Gulik community in Nunavut by air freight, and so are very sensitive to weather conditions. And the Gulik community is 94% Inuit and is located on a small island. Therefore, access to hunting areas are dependent on sea ice chill conditions from November to July and boat access during the summer open water period. And during periods of ice freeze-up and breakup, women in the community described very limited access to country foods due to the inability to hunt at this time. Therefore, temporary food insecurity is very common during these shoulder seasons. And climate change in this area is quite evident as there have been longer and later ice freeze-up, thinner ice, absence of summer pack, increasing temperatures, and changing weather patterns. However, new technologies have helped alleviate food insecurity on Ontario's north. I've provided two examples on this slide. One is in order to improve access to everyday essentials, Moose Cree First Nation and Drone Delivery Canada, a fledgling Toronto-based company, agreed to start a pilot program to deliver food, medical supplies, and mail to the community by drone. And its hope is that this partnership is the first step in expanding to more northern communities. In December 2020, Amazon opened up a new pickup depot in Iqaluit, promising faster and more reliable service. And items such as non-perishable food items are offered at about half the price as they are in local stores. So you may be wondering what's the impact on the local business. Well, Mayor Kenny Bell expressed that although local shops do donate back to the community, Amazon is supporting the community with free shipping, which is bigger than any donation. The Grassy Narrows First Nation community have lived with the consequences of the worst environmental disasters in Canadian history. In the early 1960s, 10,000 kilograms of mercury from the chemical plant at the Reed Paper Mill was released into their water system. And the contamination of this community of about 1,000 residents has affected at least 3 generations. About 90% of the population experienced symptoms of mercury poisoning, and the psychological stress associated with seeing loved ones suffer must also be considered. Unfortunately, health services are limited to a small nursing station, and mental health counseling on the reserve is nearly non-existent. On April 17, 2016, Audria was found dead in a wooded area in Kenora, Ontario. Her family and friends believe that her death was tied to the despair over the loss of her older brother, Calvin, who died from mercury poisoning in 2014. Her death has become a symbol of the social devastation that follows the environmental destruction at Grassy Narrows and the associated psychological impacts that are often ignored. Indigenous peoples are among the first to face the direct consequences of climate change due to their dependence upon and close relationship with the environment. It's unfortunate that those least responsible for causing the problem are suffering disproportionately from its effects. Increasing research has found that there are a range of poor health outcomes linked to pollution, including specific types of cancer, respiratory disease, high rates of miscarriage, and kidney disease. And I've highlighted some of these findings on this slide. The region of Nunavut, located in northern Quebec, is primarily inhabited by Inuit communities. And a study in the 1990s found that blood samples from Inuit women in the area had very high levels of chemicals. Specifically, methylmercury and PCBs were among the highest reported in the world. A more recent 2017 study concluded that pregnant women living in the area are increasingly being exposed to harmful chemical compounds that are commonly found in consumer products. The impacts of environmental issues on Indigenous peoples are widespread and immediate. For many Indigenous peoples, climate change is already a reality and is more than just an environmental issue, but one with severe socioeconomic impacts. However, Indigenous peoples worldwide are contributing to innovative strategies to limit pollution or prevent it from the outset. Indigenous peoples continue to be at the forefront of addressing climate change and fighting for environmental justice, whether it be through protests, cultural resistance camps, calls for policy action, or occupation of resource infrastructures and litigation to hold polluters accountable. A few recent examples are highlighted on this slide. Indigenous peoples and the role they play in combating environmental issues and climate change must always be considered when discussing impacts or solutions to environmental issues. Reconciliation cannot happen without the truth being acknowledged. Personally, for me, being a daughter of parents who immigrated to this country, fleeing genocide, fleeing discrimination, it's important for them to acknowledge and understand that this country that they call home did commit a genocide. This requires unlearning and learning about the history and culture of First Nations, Inuit and Métis people and communities and the ongoing acts of discrimination that they face. I would just like to end off by thanking everyone for listening to my presentation, the faculty at the University of Victoria, my professors, students, and of course, my family and friends. Thank you.